24/7.
Hello and welcome to our special show, Living Long and Healthy with COVID Vaccination. I'm Gargi Rawat. Now, this is a unique initiative which seeks to address concerns that people may have with regards to the COVID vaccination and living in the new normal. Now, the risk of COVID infections continue even as we've reduced restrictions in all parts of the country, and vaccination is the only way to counter the pandemic. Well, today we have with us experts to address any concerns and questions that you may have about the vaccinations. Joining us on the show, we have Dr. Santosh and Harkut. We have Dr. S.K. Mishra, Associate, and Dr. T. Anbu, a consultant physician and diabetologist, Associate Professor, Life Care Hospital, Kanchipuram. All right. And Dr. Anbu, currently, a lot of people have got the first dose of the vaccine, especially those who are over 60 years of age. How effective is one dose of the COVID vaccine compared to two doses?
First of all, I want to congratulate the people of India and Government of India for having two vaccines for the use of people. We have Covishield and Covaxin, which satisfy not only the country's need, almost we are catering the globe. It's a proud moment as an Indian. And we have two vaccines, I told you, one is Covishield and Covaxin. Covishield, if you take first dose, after 21 days, you will have immunity of 60%. If you take the second dose, preferably between 42 to 56 days after the first dose, you will get immunity power of 82%. This is Covishield. To the other side, you have Covaxin. You take first dose. After 4 to 6 weeks, that is 30 to 42 days, you take the second dose. After the second dose, in another 2 weeks or 3 weeks, you will get 81% of the immunity. These are beautiful vaccines. Both are equal. And difference between these two vaccines, Covishield can tackle UK and Brazil variant very well, to some extent about South African variant. Covaxin can tackle all the three UK, Brazil and South African variant. So people get vaccinated and join the fight against the corona with the nation.
Dr. Harkshra, people who've been vaccinated, and if they come into contact with somebody who has coronavirus, do they still have to quarantine? How big is the risk?
Difference between the home management of diabetes and in clinical setup. When the patient reach out the doctor for clinical management diabetes, our hospital having three objectives in front of us. Number one is to prevent the contamination or prevent the contact of the disease. This one we are following sanitization, masking and social distancing. The objective number two is to reduce the risk of exposure. If the diabetic patient having high risk of contacting COVID infections, even the mortality with normal population is around 2.3%, whereas with diabetic patients it is 7.8%. So by giving them a good glycemic control, we are going to reduce the risk of getting contaminated with the disease. And third object, if at all the diabetic patient develop corona infections, we are keeping all other vitals and the parameters stable to counteract and fight against the COVID virus. So with these three objects, the clinical management in the hospital, even though it is little bit tough, but the patient have the feel of they are seeing the doctor physically and having the healing touch.
All right, Dr. Anbu, are lab tests now essential to evaluate the state of diabetes?
So usually the diabetic patients are reluctant, any patient, of course diabetic patients are reluctant in seeing the doctor and reluctant in taking the medications and doing tests, because if the taking test is painful or not, because of all those things they are reluctant in following up medical checkup. During this pandemic, they have the chance not to meet the doctor. Actually, they are enjoying a lot to the lighter side. But after this 1 year of lockdown, when we see the patient, definitely we are going to take all the tests and make sure they are not having any macrovascular and microvascular complication, so that we can prepare those diabetic population to face the second wave, which is almost in India. So we have to repeat the lab test, we have to do the investigations, do the ECG, make sure those people are out of complications and they are ready to face the second wave.
Dr. Anbu, there's also a lot of talk about the variants now. If you could tell us a bit about that, because we've seen the kind of havoc that they've wreaked in, we're seeing what's happening in Brazil, in UK, in the US as well, South Africa, here as well. Some variants have been, detected. If you could tell us more about that.
If you ask me, what about this severity of the new variants? Usually, the virology teaches whenever a new virus arises or affect the population, it will sequentially undergo antigenic shift and drift, and lot of mutation will be there. This mutation will facilitate the microorganism or a virus to spread very fastly or reduce the spread. Usually what happens, the virulence will come down after new variants. Okay, so now we have three variants from different part of the world. One is UK variant and Brazil variant and South African variant. Of these three, South African variant has high virulence. It spread more and cause more mortality. So already I told you, the Covishield having the ability to tackle UK and Brazil variant, our Covaxin having the ability to tackle all the three strains. So don't bother about the strains. Vaccination is very, very important. Sanitization, masking and social distancing is very, very important.
All right. And we get very often. Well, thank you so much, doctors, for taking time out and answering all those queries and concerns that people have regarding the vaccination drive. And do remember, if you're eligible for the vaccine, that's the advice all the doctors are giving, that just go ahead and get the vaccine. That's the only way we can defeat this pandemic. Thanks so much for watching. Goodbye.